In this particular community, we're worried about, can I put food on the table? Can I pay the light bill? Do I have a roof over my head? So medicine comes last. That was one of the things growing up that I dealt with. My mom dealt with addiction, but I think the challenges that I had growing up with her definitely make me a better provider, specifically for a community such as this, because that's where I'm from. We are a federally qualified health center, which allows us to make sure that folks have access to care. Athena Health is really great, especially at making sure everyone is getting the same care across the board. It's looking at that patient as far as like, hey, this person is of this age, they should get these things. And Athena really helps as far as like making sure we're staying connected. It allows you sometimes to put the computer to the side just a little bit and make sure you're having that face-to-face contact with patients. It allows us to build those relationships better. Justin, to me, represents so much of the struggle that happens in this community and how a lot of our folks get trapped in this downward struggle, this downward spiral. Justin has been in and out of jail, been dealing with heroin dependence, but hopefully being here, he has the light to find his way out.
When I first started coming here, I didn't want to talk. I had to build my trust with them. They've been working with me for a while, and it's been tough with the pandemic stuff going on. It's kind of stressful. It messed with me. So when I talk to Dr. Clemens and Miss Charity, they get to know you so they can know how to work with you.
You would qualify for different programs to be, live there in transitional housing for free until you can get a job, kind of get up on your feet. That's how it works.
That's good.
Yeah.
I need that help. They saw something bigger in me, not no drug addict. They saw a person, Justin. They saw me, and they helped me out to guide me through the ropes that I need to get through. With my mental stage, I had them thoughts like, I'm not worth nothing. I'm a drug addict. I had them thoughts of that, being that. And when I talk to them, they don't see that in me. They see more. Like, they see I'm gonna be better one day. They see I'm being better now. Like, it's a lot. Just to hear that from them.
Because of Athena Health, access to healthcare and mental health care has been a bridge for us. There's definitely a stigma that we're working against in this community due to a mistrust with the institutions that have provided health care and mental health care historically, especially African American communities seeking mental health care. It's been a difficult year for everyone, but I think it's probably been a good year for mental health care. I think that a lot of people who maybe never before have said, I need to talk to someone. So here at Cahaba, we view care as a holistic approach. We do real-time visits where our patients see our primary care providers and then they see a behavioral health consultant. Because of Athena Health, we're able to give them the correct interventions, the correct medications, the correct diagnosis, because we have all of their holistic information in one place. So I think that it does help close the care gaps between the medical, mental health. Accessibility in healthcare means health. It means healing. And so through our behavioral health consultations with patients, our treatment plan, the overarching goal would be hope, but we want people's values to shine through. We want them to find purpose and have a self-efficacy that may be missing.
I've recalled a specific day where I was just dog tired, but I'm here. And having a patient tell you you're here for a reason, yeah, that gets you every time. Letting you know like, hey, your work isn't in vain. You serving a purpose. Loving what you do definitely plays a big part in coming back every day. Loving on the people that you serve, showing them that, hey, we're here because we love you and we want to make sure you're happy, you're thriving.